Hey everyone, and welcome back to Study Nurse IQ. I'm Jenny, and today we're kicking off our cardiovascular system series with a deep dive into the basics, the anatomy and physiology of the heart. Understanding how a healthy heart works is the key to understanding what happens when things go wrong in cardiac disorders. So, let's get right to it. The heart, your body's pump. The cardiovascular system is your body's transportation network, made up of the heart and blood vessels. The heart is a muscular pump that circulates blood throughout the entire body, moving about 5 liters of blood every minute. Here's the path blood takes. Blood leaves the heart through arteries, which branch into smaller arterioles. It then enters the tiny capillaries, where oxygen and nutrients are delivered to cells. Next, it flows into venules and then into larger veins, which carry blood back to the heart. A simple trick to remember this: arteries carry blood away from the heart. The main function of this system is to deliver oxygen and nutrients to every cell in your body and remove metabolic waste like carbon dioxide. This crucial exchange happens at the capillaries. Heart walls and layers. The heart is a tough organ, protected by a membrane called the pericardium. The pericardium has 2 layers, fibrous and serous pericardium. Remember that peri means around, and itis means inflammation. So a condition like pericarditis is inflammation of the sac around the heart. The heart wall itself has 3 distinct layers. Epicardium, the outermost layer. Epicardium equals visceral pericardium. The epicardium is also called the visceral layer of the serous pericardium. Epi means upon or above. Myocardium, the middle muscular layer. Myo means muscle. This is the thickest layer and is responsible for the heart's powerful pumping action. Endocardium, the innermost layer that lines the heart's chambers and valves. Endo means inner. Let's break down this concept step by step, focusing on the most important aspects you need to understand. Chambers and valves. The heart has 4 chambers: the right atrium, the right ventricle, the left atrium, and the left ventricle. A muscular wall called the septum divides the right and left sides. Blood flow is controlled by 4 one-way valves that prevent blood from flowing backward. Tricuspid valve, located on the right side of the heart, it separates the right atrium and right ventricle. Memory trick: tricuspid and right both have E. Pulmonic valve separates the right ventricle from the pulmonary artery. Mitral valve separates the left atrium from the left ventricle. Aortic valve separates the left ventricle from the aorta. The path of blood through the heart. Understanding blood flow is a game changer for nursing school. Let's trace the journey of a single drop of blood. Deoxygenated blood from the body returns to the right atrium via the superior and inferior vena cava. It passes through the tricuspid valve into the right ventricle. The right ventricle pumps the blood through the pulmonic valve into the pulmonary artery, which takes it to the lungs to get oxygenated. Freshly oxygenated blood returns to the left atrium via the pulmonary veins. It flows through the mitral valve into the left ventricle. The powerful left ventricle pumps the blood through the aortic valve into the aorta to be circulated throughout the entire body. Knowing this path will make it much easier to understand conditions like heart failure and other cardiovascular disorders. Quiz. All right, let's put your knowledge to the test with 3 quick NCLEX-style questions. Let's see how you do. Question 1. The nurse is reviewing the layers of the heart with a student nurse. The nurse explains that the layer responsible for the heart's pumping action is the epicardium, pericardium, endocardium, myocardium. Correct answer D, myocardium. Rationale. The myocardium is the thick, muscular middle layer of the heart wall. Its function is to contract and pump blood, making it the layer primarily responsible for the heart's pumping action. Here's another high-yield NCLEX point that often appears on the exam. Question 2. The nurse is explaining the flow of blood through the heart to a patient. The nurse correctly states that deoxygenated blood from the body first enters which chamber? Left atrium, right atrium, left ventricle, right ventricle. Correct answer B, right atrium. Rationale. The right atrium receives deoxygenated blood from the superior and inferior vena cava, which collect blood returning from the body. This is the first chamber that blood enters as it returns to the heart. Now let's test your knowledge with some NCLEX-style questions. Question 3. A patient is diagnosed with inflammation of the outer membrane surrounding their heart. Based on the medical terminology, the nurse knows this condition is called pericarditis, myocarditis, endocarditis. D. Correct answer A, pericarditis. Rationale. The prefix peri means around, and the suffix itis means inflammation. The pericardium is the membrane that surrounds the heart. Therefore, pericarditis is the inflammation of the membrane around the heart. And that's our anatomy and physiology review. I hope this video was helpful. Remember to like, comment, and subscribe for more Nursing Made Simple content. Thanks for watching. Don't forget to subscribe to Study Nurse IQ for more NCLEX preparation videos.